Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barela. On today's show, we've invited back John Atoni, physical therapist and owner of New Horizons Physical Therapy. We had a wonderful show the first time he was here and really didn't finish all the things he needed to talk about. Welcome, John.
Thanks for having me again.
Well, I'm glad you're here because we really didn't get through all of the things that cross our lives that cause aches and pains. I know we really didn't get things related to the spine, back pain, neck pain, and stuff during our first visit. So we want to go through those things today.
That'd be great.
Okay.
I'm glad to do it.
Well, I hope so because you're here.
Yeah.
But, you know, back pain is a real problem, and it's a real problem that starts for a lot of people when they're out doing something they haven't done for a long time, like raking leaves, picking up things in the yards, or moving their neighbor, and they end up with back pain. These people don't always need to see a physical therapist, do they?
No, I guess is the right answer.
I know you're a physical therapist and you would like them to be there, but in reality, many of us get minor aches and pains.
Right, and I think those minor aches and pains happen to, I think research has shown 90% of the human population will at some time or another have some form of back pain, whether it's serious or not. So probably 90% of the people that are having the back pain is minor. It's a muscle strain, it's overuse, it's fatigue, and it's something that given 2 or 3 days of rest usually heals itself and we don't have to worry about it. The problem is when we continue to injure the same area over and over again and don't give it the opportunity to heal. It's like someone who has to get their project in their backyard done, and they're in the second week and they've got 3 more days left and something happens and they don't want to stop. They don't give their back the rest. And so now they're playing on an injury, to make an athletic analogy. So when you're playing on an injury, you're going to have stronger consequences. And that's what happens. You get to something that's over fatigued already, you place greater stress on it and it's going to fail and more catastrophically. And so the most important thing to do is when you feel those minor aches and pains is to ask your question, why did I get this? Okay, why did I do that? Well, what happened here? You know, when you sprain an ankle, it's pretty obvious. I turned my leg, I put my weight on it, I tore my ligaments. And you would know what to do with a sprained ankle. You would stop using it, you would put it in ice, and you would immobilize it. But what you don't realize is your spine has the same mechanisms of injury. There's ligaments, muscles, in addition to discs and other little joints in there called facets. All of these things can get sprains and strains, and people don't treat them quite the same way because it's a back. They don't think of it as a shoulder or a knee or an ankle. So the same holds true. You have to immobilize it. Well, how do you immobilize a back? You use it for everything you do. You use it to sit down, you use it to stand up, you use it to walk. So it's very, very difficult at times to do that. Laying down used to be the common thing when I was first a therapist. We still had people that came in for back pain that got 2 weeks of bed rest in the hospital, under traction or without traction. That was a crazy way to treat. It made things weaker, and it allowed for the healing process, but it didn't allow for the dynamic requirements for the spine to function to return. And so now the best thing, the advice that you can give for the weekend warrior or the individual is stop what you're doing to hurt yourself. Give the back a break.
Gosh, it makes sense not to keep hurting it.
Yes, yeah, and then it's just like a pitcher coming off a pitcher's mound. I tell this to my patients all the time. They don't run out to a pitcher after they come off the mound with a hot pack. They come on with an ice pack. And so ice is probably your best friend after an initial injury, and I like ice forever.
Now, you mentioned ice a lot on the previous show that we have. However, on the television, the treatment for a lot of these injuries is icy hot, Bengay, Kramer-Jezik. I mean, a lot of heat, those things that generate heat.
Yes, because, well, first of all, what are those creams that you apply that heal you, those liniments that they're primarily based with camphor and, Bengays. What they are primarily are skin irritants to a degree.
Okay.
So if you bump your hand, ever since you were a little kid, the first thing you do, you hit your elbow, the first thing you do is this.
You rub it.
You rub it. So what you're doing is you're providing a sensation over the skin, over the area that's hurt, so that your brain perceives the skin being rubbed rather than the pain of the injury underneath. And that's basically what these creams do to a great extent.
I know you're a fan of ice, and actually I told you in the previous show I was a fan of ice for joints and heat for muscles, and now I'm an ice man. Okay, I actually listened to the guest. Let's go on, and really a lot of what you do is related to the spine.
Yeah, and the spine. If people had perfect posture, I probably wouldn't have a job. And I mentioned posture because posture determines how the stresses are applied to the spine. And so I brought this.
So you have some diagrams that people can look at while you're talking.
Right. And so this kind of just shows the basic categories of postures that we see as we go about examining patients and just watching them walk. You can't do that as a physical therapist. You see people walk around, you automatically see the posture. An interesting thing from my perspective is that, when you meet an individual, people say the first thing that you recognize of them is their face or their eyes or something like that. And I would say that 9 times out of 10, if you really thought about it, the first thing you realize is what their posture is, because you'll see their posture from across the room before you see their eyes or their face.
The face details, yeah.
Yeah, and so posture tells you something about an individual right off the bat and what they're doing, whether they're tired. A lot of things can be determined strictly from posture. And so the different postures that people adapt to are how the stresses of the spine can occur, and then when you actually perform an activity, it relates to how those structures are going to respond. And so the easiest one probably to see is the anterior pelvic tilt, or the sway back posture is probably what we see. And that would be an accentuated lordosis. So we get this kind of a look to a spine. I don't know which direction you want me to point this.
That's fine.
This is good. Okay, so
you can put it right there. Is fine.
So that accentuates the amount of extension that somebody has in the spine.
And you can see that when you do that, the discs are compressed in the back and open up in the front.
Exactly, and then that's an interesting story there that I'll get to.
Okay.
But what we have here is the spine is basically made up of one segment includes a disc, the vertebral body, and then the vertebral body below it. So this would be considered one segment, and they share these facet joints in the back. Mm-hmm. So the back is actually stacked in a series of tripods. And as we get older, the disc deteriorates, and so the front of the tripod gets lower, which then places greater pressure on the back of the tripod, which are the facet joints.
Okay.
Okay. So these are joints. And if you put more pressure on a joint than they're supposed to, they're going to start breaking down. They're going to start spraining. They're going to start causing formations of osteophytes or arthritic changes. They're going to deteriorate.
Osteophytes are little bony spurs,
Right.
little pieces of bone on top of bone.
Right, and it just so happens that our design flaw is that we have nerves that
Coming out the side.
coming out the side right next to the disc and right next to these joints. And so a lot of what can happen in this area then involves irritating the nerves, which then in turn can cause pain not only in the back but down into the leg. Everybody has a story of sciatica at some point with a relative or with themselves.
Okay.
But going back to the posture idea, we have someone who is hyperextended all the time. Every step they take, we have this little movement that occurs. And it's actually more important in women because women have a relatively wider pelvis and a relatively shorter stature.
Okay.
And so the amount of sway that hurts, and you can see what's going to happen to these poor facet joints in the back. And then you have all these muscles back here that are trying to attenuate that and control it. But then when you're stuck in here, you can accentuate the amount of deterioration that can occur.
Okay.
And as we get, I'm always fascinated by these patients that I get who are in their 70s and even 80s, that overweight female, I'm going to pick on the female,
And
overweight.
that's because females have more back problems than males do.
And they stay,
Statistically.
and they live longer than we do.
Okay.
And so what happens when they come and see me and they're having this pain, and I see that they're stuck in this posture, my form of treatment is really to try to get them to reverse this and to open it up. And that's where our exercise program is basically on flexion. I really work on flexion and then supporting with the abdominals and the saddle muscles and Kegel exercises and things of that nature. So all I'm trying to do is go from here to provide a little bit of relief with these patients.
Okay.
And I'm shocked at how well these people do. I'm always fascinated that just these little simple exercise changes can really make a change in how they feel.
You mean all these years of people telling me that I should be sitting up straight and not slouching over has a meaning later in life?
It actually does. And what we find is that people some of these ladies that I've had were secretarial in nature, and they were taught to be in this position even when sitting. And I'll see them sit like you and I can sit. And we can slouch pretty good. We're good at that. But these ladies will stay in this super perfect posture even when they're sitting, and that just causes a lot of issues over time. And so then you gain a few pounds after you get a certain age and things of that nature. It just compounds it. And so with these people, I look at the posture and I say, okay, we're going to go ahead and try flexion. We're going to see what that does to you. And if it works, great. And so my first assessment of a person is really trying to determine mechanically, which direction am I going to take this person? Am I going to take them more into flexion, or I'm going to take them more into extension? So I kind of look at a spine very mechanically.
So your object is really to return the spine to the normal position.
To a neutral
position.
Neutral and supported position.
So these ergonomic chairs that have come out for the last 15 or 20 years,
you can defeat them all. You can really defeat them all. I think perhaps the zero
but they are
gravity.
helpful.
They are well, this chair is helpful because it has a back to it. You know, I can put my back up against it and I can be supported. I honestly think that and I tell my patients
slouching in the
this.
chair like this is probably not a good idea.
No.
Okay.
Okay.
So I'll sit up straight.
Just a little bit more.
Okay.
Thank you. The best chair from my perspective, and I tell my patients all this, and I also tell them that I bought a $50 rocker from a garage sale, and I have a $1,500 sofa right here, and my $50 rocker is where I sit, and my $1,500 sofa is where my company sits. So I truly
what
believe,
you're really indicating is that part of your job as a physical therapist is to try to get them back to a neutral position where, you know, the abnormal posture is not causing
right.
a lot of trouble.
And to make people aware of what they are doing and what's happening to them, to give them the ability to manage their spine rather than their spine managing them. That's really my goal. If it comes down to that, if that doesn't work, then they need somebody with a bigger brain and a sharper object. But going back to the chair, the rocking chair is the best designed chair because of several issues. I mean, it allows you to move back, which takes the compression from straight up and down. It allows you to change the vector forces in the spine. So now, instead of being straight up and down, now part of your force is on the back of the chair. And the actual rocking motion is very soothing because it changes the pressure gradients in your discs and your muscles in your spine that are supported. So I get all my chronic back patients, I tell them rocking chair, rocking chair, rocking chair. And I truly believe that whoever invented the first rocking chair really knew what they were doing, and they probably had a backache.
Well, okay. And rocking chairs have been very helpful during it. But, you know, as we get older, weight has a big issue for
you know, I used to think that weight was such a, you know, I just said, please don't have another person that's overweight with back pain come to visit me. It was just getting like, but that's, 2 weeks ago they didn't have the back pain, they still weighed the same. Yeah, you can go ahead, this is the one straw, and that's true to what happened, but their mechanics, they were relatively pain-free, being as whatever weight they were. And so I just go back to what I'm looking at from a mechanical point of view, and am I looking at someone who is in an extension model where some of the questions I ask is, do you hurt more when you sit or do you stand? When your back hurts, do you go sit down, do you go lie down, or do you go take a walk? And that gives me clues as to what their preferential bias and positioning and their mechanics are. And so I take that information and then I apply it to an exercise program. And then I always try to shore everybody up with abdominals and pelvic floor muscles and try to get everything nice and strong. And that's really the key to maintaining a healthy back, is keeping the weight off, but also keeping the core. Everybody talks about the core, the core, the core. A lot of people don't understand what the core is.
Well, tell us what the core is, because almost every physical therapist that talks about low back pain talks about strengthening core muscles.
Exactly.
And so these core muscles must.
They're all the muscles, everything around our center here is the core.
Okay.
And so from the back side, we have our back muscles.
Right.
Okay, we've got the strap muscles, the paraspinals, the multifidi, the gluteal muscles are involved. So
that's the butt muscles.
The butt muscles, right. So all of those extensors are from the back. These guys are not as important to me in developing core muscles. These guys have always been working because we're always forward. So these guys are always holding on, trying not to let you flop to the floor. So they're every time you bend over, boom, they're on. And that's why they get so strained so quickly, because we're constantly using them. Again, if we get a good posture, then we're balanced a little bit and we're not using our back muscles as much, which gives them a little rest, a little reprieve. You're in the yard raking, you're bent forward. You're sweeping, you're bent forward. You're vacuuming, you're bent forward. And you add the length of a rake or a broom or a vacuum. So you have maybe 4 feet long, maybe 5. You've got the length of your arm, 2 feet. Now you're at 7. You've got the distance from your shoulder to your low back, another 1.5 feet. So you're looking at almost 9 feet, 8, 9 feet of a lever. And you'd have a hard time holding a PVC pipe, which weighs next to nothing, from one end straight out. And that's what these muscles are doing with much more weight. Your torso, your arm, the vacuum cleaner resistance back and forth, and then you're adding a twist to it when you're doing these things, and you're just setting yourself up for disaster here, and people don't realize that. You have to take into account that lever arm. And so if you have a core that is keeping your center solid and moving the stress down to the hip joints, then you're going to have those huge buttock muscles, the gluteal muscles, that are providing stability through the hips and not involving all this fine motion that occurs in the joint of the back that really shouldn't happen and result in failure.
And that's why backpackers, they tell you to take that waist strap and and make it really tight so that you have no weight on your shoulders.
That's exactly right.
So that you bypass your back. But then you still have to maintain a reasonable posture when you're hiking.
Exactly. And then there's a big difference between going uphill and downhill when you're dealing with a backpack as well. And so all of these things you have to take into account. But going back to the core muscles, so the abdominals are all important. So you have your you've got 4 abdominals. You have your rectus abdominals, which is one straight up and down. You have your obliques, which go this way and the other way. So you make kind of an X in the front. And then you have one that's very, very important for the core, which is called your transverse abdominis, which is kind of like a cummerbund. It comes all the way around. And that one's very important. So they're all connected to the fascia of the low back. So if I connect and strengthen my abdominals, I will, in effect, provide a firmer tube which my spine will set into, a muscular tube that my spine will be supported in all all around.
All around.
And so that's the way that we try to improve the core. And there's just a whole bunch of exercises. But, you know, the basic sit-up that people do is one of my biggest pet peeves as far as watching people do things wrong in the gym. I watch people do these sit-ups and I see their stomachs ballooning out. Every time they go forward, their stomach pops out. And they think they're helping themselves by doing that. And I like to go over and I used to go over and try to correct people. I learned that was a big mistake. I just let them do that.
Well, there's a lot of things that people do in the gym. And as a physician, I see a lot of teenagers trying to be early football players and come in with injuries. And I know it's because their technique is wrong.
Technique is everything.
And we talked a little bit about that on our first show, that the best treatment for tennis elbow is tennis lessons.
Right.
But tell us a little bit about what you see.
Well, we'll go back to the sit-up. Is what your abdominals do is they approximate your rib cage to your pelvis.
Okay.
Okay, so that's basically what they do in concert. They do a little bit of rotation. Well, the sick back is basically the rectus femoris muscle.
Right.
And so this is what they do. So when you see these guys in the jean commercials without their shirt on, they don't sit here and do that, because what is that doing? That's stretching the muscles. They're sitting there like this. They're already doing this. If you wanted to show a bicep, you would do this. You wouldn't do this. And so they're sitting there with this little tilt in their pelvis, and they've got their abdominals nice and tight, and you can get to see their six-pack. Okay, so what the stomach muscle should be doing is shortening. So you should be seeing folds in your shirt, not your shirt being stretched. You should be able to actually see folds occurring in your shirt.
I had to look down and see if I had folds in my shirt.
So, but what and obviously as you curl, you have abdominal contents that are getting scrunched a little bit. And so there is a little bit of upward motion, but the main force should be going downward toward your spine. So what I instruct my patient, we try to work on, is to take the abdominal muscles and press them into the spine and support from there. So you got to make sure that you're pushing your stomach muscle.
So it's like sucking it in?
Well, that's a word that I don't use with them, because then they'll put their pneumatics of the lungs involved. So you have to be able to talk. I make my patients count. Okay, your stomach muscles are going in. I'm sitting here with my finger poking them, and they're nice and tight, and they're counting, so that I know they're not holding their breath. Because you can go ahead and bear down and everything is nice and tight, but that increases pressure inside the spinal canal.
But the nice thing about this exercise is it doesn't require you to do weights.
No.
And you can do it anywhere.
864 times a day is the number that I tell my patients.
Yeah, I'm well aware of that number. But the point is that not everybody that can exercise needs to exercise to strengthen their abdominal muscles or their core muscles for whatever reason of back pain. Doesn't need to be in the gym and use weights, even though you probably would prefer them to be in the gym.
No, there's other reasons that they need to come to the gym, but specifically for their back and their core muscles
and stuff like that.
No, yoga is if done correctly and supervised, has a lot of core movements to it. Martial arts, you heard of Chi?
Yeah.
That's the core. Trying to make sure that the core is solid. And any sport where you're going from tennis, baseball, where you're transferring force from your legs to your arms, if you don't have a strong core, that transference is inefficient and you won't be as powerful. And so that's the other reason for wanting to have the core. So you do these specific exercises for your core. You can do them with the weights, you can do them without the weights. The important thing is to understand the technique on how to perform them, and then follow through with that, and then attach the posture to it so that you're constantly monitoring where your spine is, so that you know you're not injuring it. And again, becoming the manager of your spine rather than the spine managing.
Because I know a lot of people that do curls in the gym, and
it's scary what you see
scary
sometimes, because they're doing the sway back, and they're every time they're doing this just so that they can get that extra 10 pounds instead of staying very focused and doing a very isolated curl without involving their spine.
Yeah, I used to tell kids they need to keep your back against the wall when you do the curls.
That works great.
And that to keep your back from low back pain, because a lot of young men get that and stuff. What about using these elastic bands that you see a lot of?
They're very popular. Any kind of resistance is good for developing muscle.
And there are those exercises too that can help with the core
Well,
muscles?
the thing that's good about yes, you can, there's, in fact, because of the age group that I work with a lot, I don't work with a lot of the younger people with back problems. There's a lot more, there's a lot more of us that are older that have back problems. Because of that, everybody